Afternoon, everybody. Thanks for bearing with us. A few technical issues on our side, but I think we are good to go. Lydia, can you see how many we've got in the room now? I think we've got a good number here. We're over 20.
We're good to go.
Fantastic. Well, firstly, thanks for joining us on our webinar this afternoon. We've got a brief webinar where we're going to be focusing on high quality advice to inform education, health and care plans. So today's focus will have a lens on what constitutes high quality advice, but it'll also have information regarding ordinary available provision and where or not that sits in. Sorry, Lydia, I think it might have skipped on a few slides. If we could go back to the beginning. So what the plan of today is we're going to be looking at what constitutes high quality advice. We're going to do some sharing. So we've got some interactive sharing that's going to happen. On my screen, it's flicking through the slides. I don't know if that's the same for you. Can you hear me?
Yeah, I can hear you. Just trying to figure out how to stop sharing.
Okay, well, and we're going to have some interactive nature. So you're going to need to use your device that you're on or a mobile phone, whatever it might be. And we're going to then have some anonymous sharing. So you'll be able to see where other perceptions are on different elements of this topic. Then what we're going to do, if we go to, we're going to go into breakout rooms. And in those breakout rooms, there'll be a member of our team in Vision 360, and we will facilitate a discussion in there. We've got a whiteboard, a magic whiteboard, where you can put lots of sticky notes in to share your views. So that is the format. It's a brief session. We've got from now until 1 p.m, so 50 minutes in total. So we're going to get through a lot in this session. It's going to start with a little bit, a small amount of chalk and talk from myself, giving a little bit of context into this arena. Then we'll do some interactive sharing. And then following that, we will go back into then small groups, breakout rooms, which we will facilitate and organize, and we'll do some multidisciplinary sharing on this. Okay, Lydia, it's still flicking through the slides on my screen. Is it possible to go back to the start? So if we go back to those initial SEND statistics, so what we're going to be looking at is some SEND. What is the landscape and why is this a pertinent topic currently within the SEND sector? So we're seeing SEND numbers rise. We're seeing the SEND reform. There's a drive to long term to reduce the number of EHCPs, but that's somewhere in the future, and look at ISPs. But currently, what is the situation, or what is the context regarding quality advice? Can I just check, Mark, what slide number are you looking at on screen?
Slide number 4, Philip.
Okay, it's mine. That's not catching up. Apologies, Lydia, I was confusing you. Okay, there we go. So, SEND prevalence. What we're seeing is the numbers, the statistics from the SEND2 data that's just published. We can see a rising number. That pattern's been happening for a significant period of time. Essentially, since the first set of reforms came in 2014, we've seen the number of EHCPs rise year on year, and we've seen the number of children with SEND rise year on year. The next slide, which will show us the actual numbers, we're seeing it's around 6% of the population that have an EHCP. Their needs have been complex enough, identified, assessed, that require an education, health and care plan. We're also seeing the numbers of children and young people with SEN support also rise. So currently we know that demand is increasing. Capacity is not matching that rise in demand. And what that is resulting in is some national issues that need addressing. So the next slide, slide 6, we can see the data regarding SEND local area and CQC and Ofsted inspections. So what we're seeing is from those inspections, what are some of the key themes that are coming out? And some of those key themes that are coming out are the quality and consistency of education, health and care plans. Now, we can't look at education, health and care plans in isolation. What we're seeing is that in 69% of inspections. Timeliness, quality, and consistency of EHCPs was an area requiring improvement. And we're also, with those local authorities where there is identified widespread improvements required, 71%, a priority area was the quality of EHCPs. So we're seeing that some of those common inspection findings are plans are not consistently reflecting children's needs. Advice from EHC professionals is not always translated. So it's not translated. So you may have 6, 7 pieces of advice, children and young parents' views, children and young persons' views, parent care views. How is that collated? How is that synthesized into a high quality plan? So there's numerous things. We've got lots of different local authorities using lots of different processes and templates. One of the other areas we'll be looking at is, where does OAP, Ordinary Available Provision, sit in this arena? Is Ordinary Available Provision consistently included or not included in Section F of the EHCPs? Again, there are inconsistencies. We have SEND legislation and we have SEND best practice, but how is that being applied across the country? All of this is resulting in this sort of perfect storm of so many variables, workforce shortages, demand increasing, capacity not mirroring that, different templates, different understandings, shared awareness. So we're not seeing the quality of plans that nationally that we think that we would aspire to as a SEND sector. Part of that, and one part of that, is how we look at and consider what constitutes high quality advice. So Lydia, if you just share the slides, we'll go through the content of that and we can do the sharing maybe remotely. Okay, so what we're looking at is high quality advice and ordinary available provision. So if we look at slide 10, what we've got is, we know that an education, health and care plan will only ever be as strong as the quality of the professional advice that sits beneath it. So if we have low quality going in, we cannot create a magic wand from a subject matter expert who is writing an EHCP to create a high quality plan. So fundamentally, we need high quality advice, and ideally we need that in a timely manner to produce high quality EHCPs. However, there are inconsistencies regarding different services, different sectors, different local authorities on the format and the quality of what is coming in. And if we look at slide 11, here we've got what constitutes high quality advice on the left-hand side, and some of the key barriers to that. So one of the sharing activities we were going to do in Menti was to talk about what constitutes that and to get your agreement or what level of agreement on that. But we're saying high quality advice needs to be child-centered, it needs to be evidence-based, it has to have specificity, outcome focused, and it has to be actionable. Now, a lot of advice has all of these things, but numerous advice does not. And some of the key barriers we're having within this are workforce shortages, rise in demand, inconsistent practice, inconsistent understanding, lack of a shared cohesive approach to this, and the quality as a result is variable. And then it's around professional development, training, etc., not only for those professionals who are contributing to this, which are many, it is vast. Obviously, there are some key people who produce statutory advice for every single EHCP in terms of different services, education psychology, for example, settings, but there are other services depending on that child's complexity of need, whether they'll be involved or not. But we need to aspire to get to that high quality advice. If we go to section page 12, slide 12, the other issue that we're seeing is around differences or inconsistencies around OAP, Ordinary Available Provision. Many local authorities share their OAP guidance stock on their websites, via their local offer, etc. And essentially what we're looking at with Ordinary Available Provision is the provision that settings are expected to provide for all young people with emerging SEND from their own existing resource. Now, where it can, so examples on slide 13 of what does Ordinary Available Provision look like. we have some examples there from different local authority docs around SEMH and cognition and learning, and you'll see there's some fantastic documentation produced. If you go onto any local authority and type in OAP, you'll see their particular guidance and approach to it. But there's just so many similarities across the piece and some fantastic work. Where it gets slightly confusing, if we look at slide 14, that statement there has been lifted and shifted from one of those such advice documents. And you can see why this potentially becomes a slight inconsistency in education, health and care plans. So that statement, for example, says that OAP will not always be in section F of their plan. However, where certain strategies are recommended, they may be included in section F. So you can see the difficulty here, or the blurred lines, that where then is it left to the individual professional or the individual service to dictate what ordinary available provision goes in their assessment advice, and then for the SEND service to then unpick and decide what goes into section F and what does not. Some services clearly identify in their assessment advice what is considered OAP and what is above and beyond, additional to, different to OAP. And that's typically what populates section F of an EHCP. So what is it over and above that this young person requires to meet their needs and to achieve their outcomes? And that's typically in our section F of an EHCP. However, we're having lots of local authorities report that a lot of their assessment advices are shared, submitted, and it's difficult initially to unpick what is OAP, what is above, additional to, and then what should be included in section F. So we're seeing, this is where we're seeing inconsistent. This is sometimes where we're seeing huge shopping lists of provision as well within section F of an EHCP, and we're seeing very long, potentially not too consistent EHCPs. So it's an issue, and it's one where when we go into small groups, and we'll talk about those small groups in a moment, we have some thinking points around both high quality advice and ordinary available provision, and you guys will be able to discuss in those small groups, roughly groups of about 6 people, and you'll be able to put some sticky notes and have some discussion around this. Ahead of that sort of session of that interactive session and small group discussion, I wanted to just play a video. It's only 2 minutes long in its entirety, and I will try and talk to it if my screen stays still and I can see Lydia's slide. But essentially, why this issue and why we first put this webinar title and content together was we had local authorities utilizing, if we look at slide 15, our AI solution for helping draft education, health and care plans, which was Beta. So we call our platform Beta, and it works with the subject matter expert, the professional writing the EHCP to produce that first draft. Now, slide 16, I won't dwell on that, is some of the feedback from those local authorities utilizing it. Slide 17 shows what that feedback has come through from the local authorities utilizing it and what we've then evolved the platform to do. And the reason I pick up on this slide is that the 2 at the bottom, well, it's actually 3 of those. So the second one down, document highlighting and citations, and I'll talk about this in a minute. It was wanting to be able to see the professional advice and the context while drafting that EHCP. But local authorities were wanting any ordinary available provision tagged and potentially removed with the option to reincorporate it into the plan, and then to be able to use an AI assistant within the platform. So if we think of things like Copilot to help talk to that advice and what threads of that advice should be included, where duplication is, etc. Lydia, are you happy on slide 18 to play the video?
Yep, just do that now.
Okay, the videos, this is the last thing we'll do before we go into breakout rooms. This is just 2 minutes in total. I can't actually see the video as it's playing, so I will just talk to it. It's essentially you log in to Vita, and what local authorities were doing, they were dropping the professional advices, so social care, health, education, psychology, young people views in a variety of formats, and that would be dropped in and it would populate via AI after they tagged it. So they would tag it to indicate what areas of the plan to populate, So, for example, if it was health, they could change it to speech and language therapy, so it go into education components. What the tool would then do very quickly would then populate all of that advice into a plan, and you would be able to edit that, see where that advice has come from, but it would also recently be able to open the documents, the professional advice that sat underneath the plan in the tool, and you would be able to see those citations within context. So number one, making sure that that advice was really included. It also gives feedback on the advice, the provisions, the outcomes, where it lacked specificity, where it wasn't clear, for example. It also pick up contradictions, so if there was different interventions suggested for different frequency. But what was clear was that OAP was being increasingly populated, and we were asked to have a function to remove that OAP, but allow the professional to put it back into the plan, which we were able to build in alongside the AI assistant, which would then give them further ability to then scrutinize, amend, and pull out relevant parts of that advice, also query some of that assessment advice in terms of where it should sit and how it should sit, whether it contradicts or duplicates. So it was a really current theme for us within Vita, and it's now producing draft EHCPs for local authorities. But we felt as a result, a webinar on this, when we spoke to our local authorities, they were like, we would love to hear from other professionals, other local authorities around how they're driving high quality advice and what they are doing around the issue of ordinary available provision, whether what's been included, what's not, what they asking their professionals to do around OAP. And that is the session we have for you guys to interact. We wanted this session really to bring people together, for you guys to interact with each other and to be able to have some shared experience. We're going to break into small breakout rooms. Lydia, are you able to stop sharing the slides and share the Confluence board?
Yeah, I just got the little group discussion overview slide. I don't know if you want to have a quick talk through that.
Yeah, sure. So the group discussion is going to be essentially breakout rooms, and we're going to use a whiteboard. And in that whiteboard, when you go into your room, a member of Envision 360 will jump in and they will drop a link in. When you click that link, hopefully, Lydia, if you start showing the whiteboard, what you'll be able to do is collectively, you will all access the same whiteboard. You'll all be in there. It's to facilitate the discussion. So Lydia's got it open here for group 3. So someone will come in, they'll give you their link. You'll open that link and you'll have the ability to write on these sticky notes, add sticky notes. And if you zoom in, Lydia, there are 2 themes. So theme 1 is around high quality advice, and you've got some thinking points there, some bullet points about to structure your conversation and your dialogue. And then when you've populated some of that, you can move on to theme 2, which is specifically around ordinary available provision. Lydia's demonstrating how to add stickies, but you'll have a member of Vision 360 in the room with you. Theme 2, again, ordinary available provision. It also has some bullet points there, some thinking points, again, to structure your conversation. So the idea is that you, in a very small group, can have that discussion around what constitutes high quality advice, what some of the barriers, again, similar conversations around OAP. You can populate this, and then the idea of populating this is that we can share this with the entire community who are online today, and you will get a copy of this. So you'll see what is occurring in other local authorities, what's occurring with other SEND services, what's occurring with other professional services across education, health and social care. And hopefully it will then drive awareness, more shared understanding and potential ways forward for your individual service, your individual LA and so forth. So just to recap, you'll automatically be put into a breakout space. We will drop, so a member of Envision 360 will come into that space with you. They will drop the link in. You'll all be able to access this. And then the Envision 360 colleague will probably drop out and let you guys have that discussion and start populating that whiteboard. We will then automatically bring you back into the main room before the end to comment and talk about the process and some of the responses and to conclude the session. We're going to give you 20 minutes for this discussion. So that's sort of 10 minutes on each theme. I know it's not a great deal of time. If you're in deep conversations on the first theme you start on and you want to stay on that, that's absolutely fine. But we're structuring it around 10 minutes for each theme for the small group. So you'll have your whiteboard with 2 themes. So Lydia, are you happy to split us and automatically put us into those breakout
Yeah.
spaces. And Vision 360 colleague won't be in there immediately, but just wait a few seconds. They'll dip in and they'll give you the link to the whiteboard, and we'll be able to start that dialogue.
I'll open the rooms now.
Thank you, Lydia. And again, people, welcome back, people. Thank you so much for bearing with us and for engaging in that exercise. So what you can see on screen now is an example of one of the group's responses. So what we're going to do, obviously they're all anonymous responses. You're all talking and responding to the same two themes. So we will, when we share the slides from today's session, we will also add the links to each Confluence group, but we'll also send some static images as well from each group. So you'll be able to see how the other groups that you weren't part of the discussions with, how they've populated it and whether they've picked out similar points, whether there's consistencies, whether there's some discrepancies. But we think it's all really, really useful information for the community, for you guys, but also useful information for us when we're looking to improve some of our software to address this issue, you know, high quality EHCPs. Number one, thanks for attending. Number two, thank you for being so patient with the tech issues that I was gonna say we, but it wasn't a we, it was a royal me. So that I experienced today. But I feel hopefully that people got some value out of the content, the dialogue, the discussion, and certainly the output we'll share with you as well. Lydia will, when she shares the slide deck, she'll also provide a brief survey link as well. It takes less than a couple of minutes, but it allows you then to sort of indicate what was positive about this session, but also what themes you'd like if you were potentially going to come to a future session. What would you like the focus to be? Where would you value some input and some dialogue with people from all around the country in this sector? So we will be running more webinars. We will keep everybody informed and updated. We will send out all of the slides and all of the Confluence boards. If you didn't have opportunity to populate the Confluence boards, you didn't get to a theme as much as you'd like, they remain open. So please feel free to use that link and populate some more if you want to from your group. Like I say, the tech was our cunning ploy of not doing the Menti so we could keep our £10 e-voucher for ourselves and split it across the team. But it wasn't. But yeah, genuinely, thanks everybody. Giving up your lunch hour to do a little bit of CPD and a little bit of cross-border dialogue and discussion. It's been highly valuable for us. We'll make sure you get all of that information out and do fill in the survey, and we will make sure we're putting on sessions that are useful and pertinent to the sector. But otherwise, have a fantastic day, everybody.